I think that at this meeting and in recent months, we've heard about 90-90-90, the identification and linkage to care of patients with HIV infection. I think part of that strategy has depended on a fourth 90, and that is that the benefit of ART, the prevention benefit of ART, is greater than 90%. And I'll now report to you the final result of the HPTN 052 trial, and I'll read so that it makes sense. So the HPTN 052 trial was designed to address two questions: whether antiretroviral agents provided to an HIV-infected person would prevent transmission to his or her sexual partner, and whether earlier treatment offered health benefits to the infected individual. The study randomized 1,763 couples to an early arm, where antiretroviral treatment was started at a CD4 cell count between 350 and 550, or a delayed arm, where ART was scheduled to start at CD4 cell count between 200 and 250. The study was conducted at 13 sites in 9 countries in Asia, Africa, and the Americas. In 2011, as Julio just noted, the Data Safety Monitoring Board recommended that we make the interim results public. They never recommended the study be discontinued, but rather that we make interim results public. We reported at that time that ART provided to the early arm of the study reduced virologically linked HIV transmission from an infected person to their sexual partner by 96%, and also improved the health of the infected person. At that time, we offered ART to all infected participants in the delayed arm of the study. We now report the final results of the trial, which ended all follow-up on May 3rd of 2015. At the end of the study, 87% of the original index cases, the infected participants, remained in the trial, as did 66% of the couples. At the end of the trial, 98% of all HIV-infected index case participants, those with HIV infection, had started ART. By the end of the study, we had accrued 8,494 couple years of follow-up. So a couple year would be the partners are in the study for that duration of time. So what happened? We observed a total of 46 virologically linked transmissions. There were 3 linked transmission infections in the early ART arm, and 43 linked partner infections in the delayed ART arm. A linked infection means that we use the tools of molecular virology to assure ourselves that the infection observed in the partner was acquired from the infected index case. In the intention to treat analysis, therefore, ART led to a slightly greater than 93% reduction of virologically linked HIV transmission across the entire study. Now, intention to treat analysis may well underestimate the true power of an intervention. For example, and for this study, further study of the 3 linked transmissions in the events in the early arm showed that they all occurred either shortly before or immediately after ART was started, suggesting the viral suppression was incomplete, or when ART failure was noted. In summary, no linked partner infections were observed when the HIV-infected index participant was stably suppressed in ART. We conclude that ART is a highly effective and entirely durable intervention for the prevention of forward transmission of HIV in heterosexual couples.